So lesser toe deformities, the most common one being a hammer toe, is actually a bending of the toe at one of the joints or knuckles. The toe actually bends at that knuckle and actually stays that way. Hammer toes actually come most of the time from either a neurologic problem or possibly from wearing shoes that don't fit particularly well. So sometimes if you have a very tight shoe that's narrow in the front, your toe has to sit in there, and in order for it to sit in there comfortably, it actually has to bend. And so you wear those shoes for a prolonged period of time and your toe kind of stays in that position, and that's how you end up getting that hammer toe. When people actually have hammer toes, they'll usually come and see me in the clinic and they'll be complaining of some pain around their toes. The first thing that we like to do, I always try to start doing things without surgery. So after we do a good history and a good physical, I'll usually get x-rays to make sure that we can kind of see the bones, and where there are some abnormalities, we'll actually be able to see that. Next thing that we're going to do is try to do some things like padding of the toes. And we'll put a little pad over the top of the knuckle just to make sure that it doesn't rub on your shoe. Sometimes you can buy shoes that are a little wider toe box that can actually give you a little extra room. But usually once they start to form these hammer toes or lesser toe deformities, it's hard to get them back straight. After we decide that we're going to move forward with surgery, we have a choice of a couple of different ways to do it. A new way to do it that I've been doing for the last year or so during my foot and ankle fellowship is doing a minimally invasive surgery where we make very small incisions, just 1 millimeter or 2. We use a small blade in order to release some of the tendons, and then we can actually cut the bones that need to be cut in order to straighten them out. So if you look here, this person has a fairly large bunion in addition, but they also have this very large hammer toe, and it's crossing over the big toe. So we made our incisions, we broke the bones, we actually taped the toe straight, and over a number of weeks it healed in this very nice and straight position. And because we didn't have to open it up, the patient actually is still able to move that toe very well. We actually see you back in clinic about every week or so for the first few weeks. We make sure that the taping is going well. And then usually about 4 to 6 weeks, we actually let you start getting back into regular shoes. By that point in time, the toes are healing well. We'll check them with x-rays to make sure. We'll actually have you start at about the 6-week mark doing some gentle motion and maybe some therapy. And usually by 6 weeks, you're back into tennis shoes. I'm Dr. Jeffrey Levy, an orthopedic surgeon specializing in foot and ankle surgery with Riverside Orthopedic and Sports Medicine Specialists.